Lupus is a chronic autoimmune disease in which the immune system mistakenly attacks healthy tissues, affecting organs like skin, joints, kidneys, heart, and even lungs. And to answer some questions about lupus, with me right here live on the Splash from Henry Ford Health, West Bloomfield, we have Dr. Alireza Meysami. Thank you so much for being here, doctor.
Thank you for having me, Kevin. It's lovely to be here and share some good information about lupus. As you mentioned, very important condition that we're going to hopefully talk about that today.
Yes, yes. So let's get straight into it. I just want to know, like, some of the basics, if this is what it is. So what are some of the early warning signs of lupus that residents in Greater West Bloomfield should be aware of?
Well, great question, Kevin. So the issue is lupus actually is a very heterogeneous condition, meaning that each individual can present with different symptoms. So there is no one profile fit every patient. But there are some early signs, and I would like to make sure that we raise awareness about those signs. If the patient actually, if any person feel like they have fatigue chronically with no explanation, especially if they have also joint pain, joint swelling, and also more importantly, joint stiffness. In the morning, when they wake up, they cannot move easily and they feel pretty stiff. These are some of the signs of that. On top of that, if the patient start having some rashes, mainly we call them butterfly rash, which would be a rash and redness over the skin on the face. This is another very important clue that we might need to seek help. Sun sensitivity is another one that is early sign of lupus, and oral lesions. These are some symptoms that if you experience those, we need to actually make sure you see individual, you see a physician. So because we want to detect this condition before it can affect major organs.
Correct, correct. Especially me just learning that, just doing a little bit of research, knowing that it does attack organs like the heart and the lungs. You definitely want to get at it as soon as possible. Now, from the things that you've seen, how have you seen autoimmune diseases like lupus impact families in the local community?
Absolutely. It affects not only individual, but the whole family. First off, I want to make sure we discuss the underserved, actually, people we have in our local community. It's
Please.
important also to know that underserved community and also women of color, they actually might get the severe form of lupus. And a lot of these symptoms we discussed might actually be dismissed or contributed to other conditions. And that can result in delaying diagnosis. And as you mentioned, Kevin, that can cause permanent damage, sometimes in kidneys or heart. So we want to make sure we have early detection. Of course, in our community, definitely it can affect not only individual, but also I say that this autoimmune disease will affect the whole entire family.
Correct.
It's important to know that individuals themselves, they actually get involved with lupus and their daily routine, their work, their emotional well-being will be affected because of fatigue and pain by themselves, they can cause that issue. But on top of that, the whole entire family also will sometimes take on a role as like caregiver.
Correct.
Pretty physically and emotionally demanding task to do. And also it can cause some financial burden. So we've seen that. I've witnessed a lot of my patients, not only their life will be affected, but the entire family and even people around them, they all will be affected by this condition. So actually it's opportunity. I want to just talk about that. Then we know this disease can affect multiple organs and can be devastating and can actually affect the family and even community. So it's important to seek some support. There are some support groups. There are social workers, and we got to make sure individuals, when they encounter with autoimmune disease or they get lupus, they actually seek some services that can help them. And on top of that, actually, maybe seeking help in some places they have coordinated care, because we should put all these symptoms together, and it has to be a coordinated care, such as Henry Ford, for example. We offer such a coordinated care to our patients. Again, well-being, emotional well-being, and education they are the keys to manage autoimmune diseases such as lupus.
Education, well said. I would agree with that as well. And I'm just learning as you're speaking as well, as someone who hasn't been directly affected by lupus, but these are some things that I want to learn about so that I can get ahead of the curve in case I do have family members or friends going through this type of situation as well. And with me right here live on the Splash, by the way, from Henry Ford Health, West Bloomfield, we have Dr. Alireza Meysami, just talking about lupus, the conditions, and some of the signals that that we should look out for when it comes to this autoimmune disease. Now, doctor, kind of getting back to the topic, with autoimmune conditions on the rise from some of the things that I've seen, what community-based efforts or even screenings would you recommend, do you think, that can help earlier detection in our area specifically?
Yeah, I'm a big fan of community outreach and education. And I believe there is a potential opportunity to have some sort of events where we can screen patient at high risk. And that could be actually a female of childbearing age, 15 to 44 years, especially if they have some of the symptoms we talked earlier, and if they have family history of autoimmune diseases. Then by doing these events, we can hopefully promote early detection and prevent them from getting all those complications and damages in major organs. Of course, I'm a big fan also of collaboration with local clinics, with churches, and even community centers in West Bloomfield area. So we can connect with patients and people there. So then we can engage some of our community members who were not probably seeking help in the healthcare system for various reasons. We can get them involved and engage and hopefully help them.
Yes, I like that. Meeting people where they are. That's the main thing I took away from that. And that's very, very key sometimes, because sometimes people don't even know where to start. So just meeting them where they are is very, very key, doctor. And I appreciate that. So on your knowledge, your experience in this field, can you talk about any advancements in lupus research or treatments that are particularly promising or even relevant to your work at Henry Ford?
Absolutely. You got to see me how excited I am right now, because this is the topic I want to talk about.
Let's go.
So this is actually the time that I would just say the era of lupus, the disease that 20 years ago we didn't have more than a handful of medications that were not even effective that much. Now we have very specific medications that can target lupus directly. We have biologic treatments. There are medications like belimumab and anifrolumab, and these actually are basically made for lupus and they target it directly. And that actually can change people's life, especially if they have lupus. Now, at Henry Ford, I'm a principal investigator of almost all the clinical trials for lupus. We have clinical trials with new medication on the horizon, and they're coming, and we are offering those to our people of community. If either they had no response to existing treatment, so we offer them to new clinical trial, or if they have no access. Now, another interesting thing is we are about to start a new treatment for lupus. I want to make sure your viewers actually know about that. They call it CAR T cell therapy. These actually are fascinating treatment for lupus and autoimmune diseases, where we reprogram our own immune system to go attack the bad cells and bad immune cells and destroy them. So we actually reprogram our own body to fight against the disease. And so far, we've seen patients for like more than almost 3 years. They remain disease-free, medication-free. So we are about to start such a clinical trial at Henry Ford and hopefully getting closer to the big word cure. It's too early to say that, but maybe one day we can take care of lupus patients completely.
Yeah, that's what we want to work towards, eradication, getting it out of here eventually and managing it at the very, very least. And when managing it, let's talk about that. What lifestyle changes do you often recommend to patients in Greater West Bloomfield looking to reduce their risk or even manage this autoimmune disease?
Wonderful question. And actually, I spend usually about a good portion of my visits about lifestyle modification. Very important, even though simple. So first thing is we got to know patients with lupus, they need to have restful, consistent sleep. Sleep is important because that's our reset time. If the sleep is not restful, please seek help and see some specialist or your primary care physician to have a good quality sleep. The second thing, I am a big fan of anti-inflammatory diet, a balanced diet. So it's important to think about some anti-inflammatory diet. Maybe eliminate sugar. That's a fuel for inflammation.
Man, yeah.
Gluten, cut back if you can. And even, some additional, like maybe turmeric would be good addition, and a Mediterranean diet. A low impact regular exercise routinely would be very helpful. Avoid the smoking, and I will limit sun exposure. Because sun, actually, the UV light can trigger lupus and actually can cause major lupus flare. Now, last but not least is stress reduction. Stress, for some reason, has a lot to do with flare of the autoimmune disease and lupus. So I tell my patient, use some meditation technique, try to control your stress. These simple tasks, even though they might look simple, they are very important, if not as important as medical treatment, and we won't be successful without having all those in place. And together, we should just work with the patient to help them.
I'm so glad that you, once again, as a medical professional, make the connection between mental health, your stress, and then your physical health as well. Like, I don't think people really focus or talk about the connection between non-stress or, trying not to stress or managing your stress and then the effects that it can have on your body. So I'm so glad that you put that out there as well as something that can manage this autoimmune disease, as well as talking about the light impact, the low impact exercise. That was one thing that I would have thought, but I'm not the professional. So I'm glad you took the time to explain that as well. And I don't want to take up too much more of your time. We appreciate you, doctor. But lastly, what advice would you give to someone in our community who may suspect that they have an autoimmune disorder, but haven't yet talked or sought medical professionals yet?
Wonderful question for the last question. Listen to your body. Listen to your body.
Yeah.
If you see that there's some symptoms, especially fatigue, joint pain, and rashes, that's been going on for a long time with no explanation, please seek help. You can see your primary care physician. They can run some small screening tests, and then you can see one of us, rheumatologists, and we can definitely help you. Early detection is the key. You don't want to wait until lupus goes to the kidneys or major organs. Then that will be actually a major complication.
Yeah.
You deserve to feel well, and trust me, we are here to help you. Just reach out, and you will get treated, and we'll help you be helped.
Hey, doctor, I appreciate that information so much. I got more research to do myself, but we definitely appreciate you, your information, and your time. Once again, from Henry Ford Health, West Bloomfield, Dr. Alireza Meysami, thank you so much.
Thank you for having me. Have a great day.